Now, one of the things that I got confused about for a long period of time were all these different terms, like the neuropraxia versus neurotomesis. Like, can you kind of go over what the different terms are, just so we can have a basic, understanding of what these different terms are and what they mean?
Yeah, I mean, I think that, when nerve injuries were originally being classified, they thought about, it very simplistically. Is the nerve intact or not? Right. So if the nerve is not intact, you have literally two ends of a nerve. That's a neurotometic injury, the most severe. Okay. It's pretty easy to say that's probably not going to get better on its own unless you have some fateful case where the nerve ends are lying right next to each other, in good alignment. So probably most likely not going to get better on its own. And then you have cases where perhaps you have, a crush injury to the nerve, but the nerve is still intact. That's probably an axonometic injury. In some select cases, you can have a demyelinating injury to a nerve, which is the quote neurapraxic injury. I think that in orthopedics, for some reason with nerves, we tend to think that things are going to get better on their own, which many times they will. We always think that nerves or nerve injuries are quote neurapraxic, that it's just a demyelinating injury. But I bet more often than not, there is a low grade axonometic injury. So that's that middle grade of injury where it's honestly really hard to figure out what's going on with the nerve. Because my job as somebody who is treating patients with nerve injuries is to see that injury, see that patient, understand the mechanism of injury, and try to prognose what is going to happen to that nerve. Is it going to get better on its own? Is it going to, inevitably not get better? And do I leave myself enough time to intervene in whatever way necessary to get, you know, um, to get axons to that muscle before it atrophies? So
Right.
that's the rub there. That's when it's really hard to figure out, because everything's not neurapraxia. And I think that we tend to chalk things up to neurapraxia when it's not.
Yeah, and I know I'm almost positive in my history, in my very short limited experience, I have misnomered or misnamed, something that's neuropraxic that I say is neuropraxia, which may not necessarily be a neuropraxia. So it's definitely good to be able to know that there could be kind of like a range of injury to the nerve. We may not exactly know what's going on. But just to recap, you said a neurotometic injury is when you have injury of the entire nerve. Axonometic injury is when you have an injury to the axon, but the connective tissue or the tissue around the nerve may still be intact. And then kind of this demyelinating injury, that's kind of the neuropraxic injury. And what, because I always, at least I've definitely always seen these in test questions. How do you, is there a special way that you remember what you lose first and what you gain first, as far as, the function of these nerves or function of the muscles? I always hear, motor versus touch, or pain, sympathetics. Is there any way that you use to remember that?
First off, I think that any test questions that try to have you differentiate between neurapraxic and axonometic injuries are inevitably unfair because I think many practicing hand surgeons and peripheral nerve surgeons will disagree on that or on their, when
Yeah.
we're discussing things. So that's, but in terms of like things that you lose first, right? Like it totally depends on like what kind of nerve it is, right?
Okay.
I know that the test will tell you that if you have a mixed nerve, you're going to lose the motor first, and then you're going to lose proprioception, and then touch, and then temperature and pain and sympathetic, and the recovery tends to be the opposite direction. But I will tell you, where this, there's the test world and there's the real world, and it's a mixed bag, right? So it totally depends on what kind of nerve you have. Is it a mixed nerve? Is it a motor nerve? Is it a sensory nerve? Depending on where you catch it along the chain. Uh, when you're dealing with the injuries that you're trying to figure out the most, you know, they're all there. It is completely gray.
Okay. All right.
So I'm
Uh,
sorry if that doesn't help you with anybody
no,
who's doing
no,
OIT.
that helps. No, it does help. I mean, because there's always a test question or a test answer, and then real life, and you see this not just with hand questions, but with questions all over. So I think it's good to realize that what may be the test answer in real life when these patients come to your clinic, it may not necessarily present that way. So if you don't know that, you may, it may be something that you don't think about and something that you don't catch. So I think it's something that we should all at least know, and then therefore be able to recognize when an injury may present itself in a not so classic or testable, form or question.
Well, I mean, like, when you have an injury that, say it is purely a sensory nerve. Like, for example, say you got the superficial radial nerve and it was cut and you repaired it and it's recovering. Like, you will get, pinprick pain sensation first. And then you will get, hot and cold sensation first. And then you will get moving 2-point discrimination first. Then you will get static 2-point discrimination. And then you'll get, the vibratory tuning fork kind of things next. So that does happen. But it's just so rare that you get that injury, that you get to follow that patient, in that order. Because more likely you're going to get, a crush injury to the median nerve, which is likely a Sunderland 3 versus 4 axonometic injury. And you and your attending are trying to figure out whether it's going to get better on its own. You might see a little bit improvement in sensation. You might see a little bit of improvement in motor, and then it plateaus, and then you don't know what to do, and then you have to explore. Or you say, you know what, you're going to get what you're going to get, and that's it. And that's the real world. So
Yeah.
there is just, the test questions are such because, sometimes they're true in very cut and dry black and white scenarios, but
Hmm.
as you mentioned, the real world is not black and white.